You're watching CTOM TV. Knowledge is power.
Targeted therapies are really what precision oncology is all about. So a targeted therapy is a drug, and there's many examples, that target a specific molecular feature or mutation. And so since the creation of the Human Genome Project, most of the drugs involved in cancer have been targeted therapies. We haven't really done any new chemotherapy drugs. There's been some alterations of chemotherapy drugs, but we haven't really created any new ones. We've just, still using the same old 50-year-old chemotherapy drugs. So targeted therapies basically are only good for someone that has the mutation that the drug is designed to target. And they're very selective and they work quite effective. So typically what we do for any person with cancer is we will isolate the patient's tumor cells, and then we'll extract the DNA, and we'll do something called tumor DNA sequencing. We'll also do expression testing, but tumor DNA sequencing basically takes about 500 to 600 genes and then looks at the mutations in these genes, and these are genes associated with cancers. And then it comes up with allows you to come up with a combination of drugs that target the mutations that are specific to your case. And expression testing looks at about 20,000 different genes, and it looks at the expression of these genes in the cancer cells and compares them to normal tissues. So expression is at the actual amount. So these two tools together are very powerful, and they allow us to come up with all kinds of different treatment options that would never be assessed in standard care. Often these are off-label treatments. For example, we're using breast cancer drugs in prostate cancer patients, and brain tumor drugs in breast cancers. So there's all kinds of different approaches, off-label drugs, and these are the tools that tell you what works for you. Unfortunately, while they have gone down significantly in cost, they're still fairly expensive, but it's well worth the money if you can afford it. So you've probably heard of the BRCA1 and 2, BRCA1 and 2 mutations. They were first identified in breast cancer patients. BRCA1 and 2 are what we call tumor suppressors. They maintain the integrity of the genome. And if a cell has certain types of mutations, then these genes get turned on and they're involved in either fixing the mutation, or if they can't fix the mutation, then they will prevent that cell from growing and dividing, and often they will cause that cell to go through programmed cell death called apoptosis. So we find a lot of BRCA1 and 2 mutations in prostate cancers. And right now, there's two drugs, olaparib and rucaparib, and both these drugs have been FDA approved for prostate cancer. So you want to be looking for mutations in BRCA1 or 2 to see if these drugs are options for you. And there's also a bunch of other genes associated with BRCA1 and 2. We won't get into that now. We call that BRCA1/2 NES. They're the associated genes such as ATM and PARP, and lots of different genes that are also associated that can tell us whether PARP inhibitors will be effective.
Thank you for watching CTOM TV. Subscribe below and stay informed.